My name is Morgan Foster, and this is my clinical case report presentation over bilateral osteogonum syndrome in a collegiate soccer athlete. This was a level 4 case report. Some background on the patient: she was a 20-year-old female NCAA soccer player, had a history of deltoid ligament repair to her left ankle, and a upper lateral calf wound infection as well. The patient reported to the athletic training facility after practice complaining of bilateral heel pain that was progressively getting worse. Some of the key findings from that evaluation can be found listed here. The differential diagnoses included Achilles tendonitis, retrocalcaneal bursitis, Kager's fat pad irritation, as well as osteogonum presence. The patient received 3 weeks of conservative treatment to try to relieve her symptoms with no significant improvements found. The patient was then referred out to the team physician and received MRI imaging, which showed the presence of bilateral osteogonums as well as a ankle synovectomy or synovitis in her left ankle. The patient decided to go with open osteogonum excision for both ankles, as well as an arthroscopy with extensive synovectomy for the left ankle. This presentation was wrote about 4 weeks after the surgery was performed, and the patient had already experienced a significant improvement of her symptoms and was already completely without pain during the time of writing this presentation. This is a picture of just a general X-ray and MRI finding of an osteogonum. And then the 2 pictures below that are just examples of exercises used in the phase 1 of post-op treatment for this patient to improve both range of motion as well as strengthening intrinsic foot muscles. Osteogonum syndrome is rare and it only occurs in about 7% of the population, and it's more common with appearing in adolescents rather than skeletally mature adults. This case was unique because she had the presence of bilateral osteogonums that were initially asymptomatic that just had suddenly become symptomatic after her deltoid ligament repair and as she was coming back from that injury. A conclusion to this presentation was that even though this is a rare occurrence, it is important for athletic trainers to be able to identify susceptible athletic populations, as well as we should not be overlooking possible anatomical abnormalities that may predispose certain athletes to these rare injuries.